Hi, my name is Brujic. I'm a private practitioner in Northwest Ohio. I'm actually a partner of a three-location optometric practice, Premier Vision Group, and I'm joined here with Dr. Miller, and we're going to be talking about some interesting things this evening, in particular when it comes to contact lens fitting, the process, and understanding some of the logic behind follow-ups. Jay, I guess to start things off, what do you think about contact lens follow-ups, especially with the technology and lenses now? Are they necessary? Are they unnecessary? Give me your thoughts.
Yeah, thanks, Mila. For sure, I think contact lens follow-ups are still critically important to the contact lens care that we provide. There are times that a patient needs some extra fine-tuning. They need some extra hand-holding, especially when it comes to specialty contacts, when it comes to multifocal lenses, when it comes to your toric wears. So there are times that contact lens follow-ups can maybe be skipped, but I still think by and large, on a vast majority of my patients, I prefer having them come back for a follow-up appointment.
You know, Jay, that makes sense. 10, 15 years ago, when contact lenses, technology-wise, weren't what they are right now. But when you're looking at a spherical contact lens wear, in particular, that you may be fitting in a daily disposable lens, and you're looking at on-eye performance initially, you're looking at great initial, first of all, high patient expectations. You're actually producing those great clinical outcomes immediately on eye through great vision, and the fit looks amazing. I personally don't necessarily feel that those types of patients need a follow-up visit. I go as far as to even extend that to daily disposable lens wearers who wear toric lenses. Now saying that, yeah, maybe a 2-week or a monthly toric lens wear, I think that that's a necessity. I truly feel that you gain knowledge about understanding what those contact lenses look like after 2 weeks or after a month of wear, because that's actually going to be critical to the success of their lenses. And you can also instill the habits that go along with contact lens wear and care with things like proper contact lens disinfection, proper cleaning of the contact lenses, whether or not you think they maybe have to go into a peroxide-based solution. But when you're talking about a run-of-the-mill spherical lens wear or even a toric lens wear that you may be fitting in your daily disposable lens, I don't know if a physical follow-up is actually required, Jay.
Yeah, so I think it's important that we clarify. There are some patients where it depends. I love that Dr. Good, one of my professors at Ohio State Optometry School, he often said he would ask us questions during his lecture, and then he would come back, and the answer really came down to it depends. And honestly, in this situation, it truly does. It depends on the situation. There are many situations where a patient's been a long-time contact lens wearer, they know your practice, we know them, and you refit them from a 2-week lens to a daily disposable lens, or from a monthly lens to a daily disposable lens. And there are times that I will allow them to call back if they have any concerns, but let them go ahead and order that supply without any follow-up care. By and large, though, like I said earlier, with my new patients, with patients that I don't have a previous history of, a new fit, I think it's pretty critically important to maximize comfort, to minimize health concerns, to take the time to encourage them to come back for a follow-up visit.
Yeah, I agree with you there, Jay, especially new wearers. Even in daily disposable lens wearers, I think there's value to that second visit. One, making sure that they're handling the lenses okay and there's no issues that you can maybe curb or make easier for them. But two, to just help them understand initially what contact lenses truly and how they function, and any other points that you could actually add to them, and just to make sure there aren't any true adverse events for that new first-time contact lens wearer, which there really aren't when you're talking about a daily disposable modality. But you know, Jay, there are exceptions to the rules as well too. Just like you said, every situation, it depends on what you're actually doing and how you're fitting those lens wearers. You know, there's some recent challenges that exist in the marketplace, Jay, because of multifocal lens wearers actually now being available in daily disposable options. I mean, two that come to mind are the Daily Zoco Comfort Plus multifocal and the ProClear One Day multifocal. And these are packaged sometimes in 5 and 10 packs. So when do you have those patients back? I mean, how do you logistically get over that curb or that hump where you might only have 5 or 10 trials that you're giving the patient? How do you run those follow-up visits with those patients?
You know, that's a great question, Mila, and I agree 100%. I think managing your trial bank is critical. In those patients, I try to have them back sooner, whether it's in 4 or 5 days. If I make a change in their powers, I'll allow them I will give them those new powers. If I don't make a change and we're going to order, then what I typically do is allow them to either give them a close power, give them something close to their prescription to get them by, or we let them go ahead and order and let them either go to their glasses or go to an older lens that they were wearing previously to that fit. It is a challenge, and but I don't think that we have to have a patient wear that lens that we fit every single day from day 0 and on. And honestly, sometimes it works out in our favor. There are times where if we run out of a lens, they go back to their old contacts and they realize, wow, this lens was a lot better than you prescribed. And I think some of the new daily disposables, like we talk about, some of the new, DT1, the True Eye, some of the new technology lenses out there that provide improved comfort, that provide a new option for our contact lens wearers. Certainly, those types of lenses, patients can get that wow factor, reinvigorated after they've gone back to their old lenses.
Jay, I've had a chance to do this with a few patients. What I'm going to share with you right now, I think it's mandatory, and I think you as well too. For the multifocal lens wearer, it's really difficult to perfect that fit without having that patient back. The challenge is, though, either with a 5 or a 10-day supply, it's sometimes difficult for that patient to really adapt or adjust to their environment. What we've started.
Thanks.
Bless you. Don't get nervous, Jake. Yeah. Don't get nervous on me. So what I've done, and I've done this a handful of times, Jay, and it's actually worked really well so far, is dispense to 5 diagnostic lenses in the daily multifocal lenses, but then actually ordered a 30-pack for them so that they're vested in the process immediately. And in addition to that, they have 30 days of wear, so now we can follow up with them after about 2 to 3 weeks of wear, where when we see them again, if we need to make any fine-tune modifications, we can, but we also have enough time to get their new lenses in. And what's cool about that is, in particular, if it's a new contact lens wearer, there's recent data that shows that contact lens wearers, multifocal lens wearers, need 2 weeks to get used to those lenses and really understand the optics and the true benefits and advantages and disadvantages of the lens. So it gives them that 2-week time period. It puts them, invests them into the lens option immediately, and it also gives us time and leeway to work with them. So if we do need to make those minor modifications, we can do that before we actually go ahead and order then ideally the year supply after that. So I don't know what your thoughts are on that.
Yeah, that's great. I think that those patients require a little more hand-holding because I think when it comes to multifocal wearers, the biggest concern is that they are going to stop wearing their lenses before they come back to see you, if they're having troubles with them. So I think patient education is critical if you're going to use a system as you propose there, and I think that is a great system. And as long as you talk to your patients about ahead of time that does take a little bit of time for your brain to adapt to these lenses, that it does take. So because some of those patients I've seen, and I've experienced some of them that have been able to wear their lenses, they've tried them, and in the first few days they said, you know what, I just can't even wear these to drive, or they're having troubles at work, and they say, I'd rather go back to my glasses than continue to wear those. So I think those patients are the ones that if you can catch them early with that follow-up visit, it can make a big deal. But you're right, in managing those trials and whether to order a supply, a 30-day supply at the beginning, or whether to have them back and then maximize those dollars and turn them into a 90-pack. I think it does depend on the type of patient. By and large, if those patients have a good buy-in, you have a good relationship with them, then I think that's a really good avenue. For new patients, though, I like to see them back quicker, sooner, and watch them a little bit closer and kind of hold their hand through that process, because I think those patients can take up the most time in your clinic, but they can also be some of the most rewarding if you can achieve success with them.
Jay, I appreciate all your candid feedback, and unlike most of our conversations, you actually made cohesive sense during this conversation, and I appreciate that for my sake, for Colleen's sake, and for all the viewers' sakes. Thanks everybody for joining us on this Google Hangout, and feel free to reach out to myself or Dr. Miller if you have any other questions or comments on anything that we talked about or went over.
Yes, and thank you everyone for joining us. Thanks, Mila, and I was glad to work on this together and a great project and continue to grow that contact lens population. I think that's a strong area in your practice and work hard at it and whether you agree with either one of us, continue to develop that model that works for you in your practice. Thanks.